Welcome everybody into a conversation that we are calling Let's Talk About Fibroids. And the reason we are having this conversation is because so many women right here in Atlanta and really across the world experience this diagnosis, or some people are dealing with fibroids and they don't even know what exactly that they have. So we wanted to bring in some people into the studio to have a very important conversation. And I want to introduce our panelists for you tonight. We start with Dr. John Lippman, the founder of the Atlanta Fibroid Center, Latoya DeWright, the founder of Fibroid Pandemic, and Dr. Madeline Sutton, the founder and CEO of One Brain for Health. I want to welcome you all in. First of all, thank you so much for taking the time to be with us here today. So I want to start off this question, and we'll direct this question to you, Dr. Sutton. For those who are watching and they don't know what fibroids are, what are they and how common are they here in Atlanta?
Oh, great question, Faith. So fibroids are extremely common. You know, a couple of years ago when Vice President Kamala Harris put forth a bill to try to get some funding for fibroid research and treatment, she gave the correct number. We estimate that there are about 26 million people with uteruses, uteri, affected in this country. We also know that Black or African American women are disproportionately affected, about 80%, and for non-Hispanic white women, about 70%. So we know that it's a very common diagnosis. Most people don't have severe symptoms, but for those that do, we definitely have a range of options that we like to talk with them about and offer them.
Absolutely. And Latoya, I want to just kind of follow up with what Dr. Sutton said to you, because you are somebody that I met through my reporting who has experienced fibroids and has helped a lot of women handle it. Can you talk to us briefly about what are those symptoms and when did you learn that you had fibroids?
Yeah, and I always have to start with this, Faith. You should know this by now. Thank you so much for having me. I know there are going to be so many other people sitting in the seat, and I do not take it for granted, so thank you so much for having me. So for me, I learned that I had fibroids, what I call by divine order. I used to say by mistake or by happenstance, but now I believe it's by divine order. And what my situation was, me and my husband did not, well, my fiance at the time did not want to have an unplanned pregnancy. So I got the IUD, the Mirena IUD, implanted. Went to go get it replaced 5 years later. And my OBGYN, who I had been going to at the time for 12 and a half years, couldn't find it. So she sent me an ultrasound within her doctor's office suite. And the ultrasound tech was able to locate it. And she asked, well, hey, how are your fibroids coming along? And my response was, what's that? I had no idea that there were fibroids on my uterus. Again, fibroids are non-cancerous tumors of the uterus. And I got back in there with the doctor, and she was very almost cavalier, asking, well, you know, we're gonna have to reschedule you because too much time had passed. And I said, well, can we talk about the fibroids that the ultrasound tech mentioned? And she said, well, her first question was, do you plan to have any more children? And I said, well, no, I wasn't necessarily planning, but I had just gotten engaged and I would like to preserve my fertility if possible. And she said to me, well, I recommend a hysterectomy. That was the first and only option she recommended. And 4 years, I did my own research, and I eventually decided to have a non-invasive procedure called uterine fibroid embolization, also known as UFE. Some of the most common symptoms are menorrhagia, which is heavy and or prolonged menstrual cycles, brain fog, even to a point to where you may develop pica because of the menorrhagia, because a lot of extreme loss of blood can contribute to anemia, and anemia actually causes hair loss, brittle nails, as well as pica. So those are some of the most common symptoms, but some of the most serious symptoms, what a lot of people don't talk about, is reproductive issues, all the way to as serious as infertility, and even cardiac issues and circulatory issues. Those are things that people don't talk about. So when they tell you that fibroids are non-life threatening, that's just not true.
Now, Dr. Lippman, I want to bring you in here because Latoya mentioned something that you are very well versed in, and that a lot of women, people don't know that there are alternatives to hysterectomy. So could you weigh in on that?
Yeah, sure. The gynecologists are the gatekeepers of women's health, so patients will obviously go to see their gynecologist, and unfortunately, oftentimes they only hear about the surgical options for treatment. As Latoya mentioned, they ask if you're interested in fertility, and if you say you are, you get offered what's called a myomectomy, surgically cutting open a woman, cutting out some of the fibroid tumors. Then typically don't get them all, and that's a big problem with myomectomy, is that there is a high recurrence rate. then they close the uterus and close the woman. So if she's interested in fertility, she gets a myomectomy. She gets offered a hysterectomy if she's not interested in fertility, as Latoya found out. We do a procedure called uterine fibroid embolization. It's a non-surgical, outpatient 30-minute procedure. Patients come into our center, 30-minute procedure. We knock out all the fibroids from the inside under X-ray guidance. And so all the fibroids get knocked out. The symptoms then start to go away as these fibroids die, they soften and shrink. And as that occurs, the symptoms start to fade away and disappear, usually by the time we see them in follow-up 3 months later. So the biggest issue with UFE, and it's covered by all insurances, it's been around a long time, this isn't anything new. I've been doing it here in Atlanta for over 25 years. But the biggest issue is that most women still, to this day, even though it's covered by all insurances, aren't being told about it. And they're entitled to know all the options, not just the surgical ones.
Now, Dr. Sutton, and I want to bring you in on this as well, working in a traditional hospital, you are amongst all of the women patients that are getting recommended care. Is this something that is brought up in in your work area, or is this something that people still don't talk much about?
Absolutely. Thank you for the question. So yes, I'm also a board certified OBGYN, and one of the most common diagnoses we do see and take care of include fibroids. And so, goodness, that's awful that GYN didn't offer you all the range of options. Here's what should happen if you believe you have fibroids or if you've already been diagnosed with fibroids. You should start by seeing your gynecologist, absolutely. You should start by having a full history and physical exam. During that history, it's very important that you share whatever quality of life concerns you have. If you're bleeding to the point that you're soaking your clothes and it makes you uncomfortable to go out to different events, that's one of the most common things people say. I couldn't even go to the Labor Day picnic because I didn't want to wear white clothes because, when the bleeding happens, it happens very heavy and very suddenly. And so that's part of the conversation that has to happen. During the physical exam, after you consent to the pelvic part of the exam, there's what we call a bimanual exam. And one of the first conversations you'll have if you have fibroids is, okay, well, what size is that uterus? And a lot of times during that bimanual exam, we'll be able to describe it in something that might be familiar with the person. Oh, I feel that maybe it's about the size of an orange, or it's about the size of a watermelon, or sometimes we'll use the equivalent of a pregnancy, 20 weeks pregnant or something like that. But we don't stop there. Ideally, the person should be referred for an ultrasound. The ultrasound is really where we get into how many fibroids there might be, the sizes of those fibroids, where they're located. And after all of that happens is when we begin to talk about different options. Ideally, the residents and the med students and OBGYNs that I work with these days are absolutely, as far as I know, having conversations about all the options. Those options can include medicines, depending on the size, again, as well. They can include IUDs that can have progesterone in them, that can be placed into the uterus like she described, and sometimes decrease bleeding if that's one of the symptoms. They should also be told about uterine fibroid embolization. I think when you talk about surgery, surgery is very invasive. And when I'm talking with patients, I think that should be absolutely the last resort. And so if you have fibroids and if those fibroids are appropriate, we go through the steps of getting those things that the radiologist would need. So they would need to know what the pap smear result is. They would need to know if the person has heavy bleeding, what the endometrial biopsy is. And then they also usually ask for an MRI. And so there are many patients who want to learn more about UFE. We go the route of getting those things, and then we make a full referral to radiology.
Yeah, and I'll see those patients in my office. So, sometimes people think radiologists don't care for patients. I see patients every day in my office. And so we have a very close relationship with gynecology because sometimes we do procedures together. Sometimes we refer to gynecologists because the patient really isn't the best candidate for UFE, would be better handled surgically. So some patients are better surgical candidates, some patients are better UFE candidates, and sometimes we end up working together. And Dr. Sutton brought up an interesting point earlier about the bleeding. fibroids are the #1 reason why women have heavy periods. And sometimes women, even though they bleed for a long period of time, they don't even realize that's not normal. Because they've been bleeding for so long that way, they think that's their normal, and it's not. So if you're changing pads more frequently than every 3 or 4 hours, if you use 2 at a time, or if you're seeing clots bigger than a quarter, if you get the kind of gushing, flooding, horrible periods, crime scene-like stuff, clots that are big, those things, that's, no matter what your hemoglobin level is, it's abnormal. And if it if it affects your quality of life, it's abnormal. It doesn't matter. Sometimes people get hung up on what your hemoglobin level is. It really depends. If your quality of life is affected, then it should be looked into, and you should talk to your gynecologist about that. And nobody knows your body better than you. You're the CEO of your body, and so if it's bothering you, bring it to the attention of a physician. And if your physician doesn't pay attention to you, or doesn't, you feel like you're not being listened to, find another doctor. There's plenty of good doctors here in Atlanta.
And Dr. Lippman, that takes me to my next point, and I want to ask you about this, LaToya, because you are one, and I'm sure you are not the only person who has spoken up and felt like their medical provider wasn't listening to you. And this is really a two-pronged question, because we have 2 medical providers here, and then we have somebody who has gone through this. What is your advice to other women who feel like they're not being listened to? And then if you all could weigh in too as to some advice for those who, if they feel like they're not being listened to, just from, have you all experienced that in your hospitals? But LaToya, let's start with you first. Just some of that advice for people who might be in your seat.
Absolutely. So to Dr. Lippman's point, if you do not feel comfortable with the answers that you're getting or lack thereof, get a second, third, fourth, or fifth opinion. Get as many opinions necessary until you feel comfortable with the conversations you're having with the doctor, number 1. Number 2, have conversations with your family. Talk to your mother, your aunties, your grandmothers. Talk to the women, and sometimes the men, and your family, just to get a good, well-rounded understanding of what other women dealt with in your family, because it's very likely that if your mother or someone close to you had uterine fibroids, you're likely going to develop them as well. So that would be the main things I would definitely suggest. If your doctor's not hearing you and you're feeling unseen, you're feeling left, abandoned, then you have to be your biggest cheerleader. Be your biggest cheerleader. Like Dr. Lippman said, you are the CEO of your body. Be your greatest advocate. I'll tell you, Faith, had I not been my greatest advocate, I would probably still be at point A as I was over 10 years ago. Now I'm thriving, and this is definitely something that other women or humans with the uterus can experience. They can experience thriving with or without fibroids.
And there's over 1 million women in this country right now sitting on the sidelines because they don't want surgery. We call them the silent sufferers. They're suffering with fibroids. They don't want surgery, and so they just suffer with it. It's, for the vast majority of people, it's not going to kill them, but it's going to make their life miserable. And so they just suffer with these horrible periods. They pad themselves up with multiple pads. They have changes of clothing they walk around with. They have to know where every bathroom is. Everything they do or don't do revolves around this horrible monthly menstrual. Yeah, it's a lifestyle. So they, whether they work or not, whether they have relations or not, whether they swim or not, whether they have events or not, everything they do revolves around it. And so it just doesn't have to be. You don't have to suffer in silence. You can look at some of these other alternative procedures, because surgery is a very significant invasive procedure, and in my opinion, hysterectomy should be the absolute last resort option, because UFE is so good, you don't need to lose an organ you were born with over benign disease. If you have cancer, obviously it's appropriate, but for benign disease, it should be an absolute last resort. But unfortunately, I wish Dr. Sutton was the norm. She's the exception. But most gynecologists, and we've done studies on this, most gynecologists to this day, despite the long track record and safety and efficacy of UFE, most gynecologists in the community won't mention it as an option, and that's just wrong, because women are entitled to know all the options. How can you make an informed decision if you're only given the surgical choices?
And to that point, I honestly feel that, because I kind of struggle with that too. I always wonder, why aren't these doctors educating the patients about other options. There are probably 10 different things you can do to help mitigate fibroids. And I honestly believe that number one is outside of their school, their scope of work, right? So they don't really know. And then not only that, like statistically, humans with the uterus suffer for up to 4 years before they take action. 4 years.
Yeah, that was from a study from the Mayo Clinic back in 2013, Journal of Women's Health. The chief of OBGYN, Elizabeth Stewart, put out the study at the Mayo Clinic. They looked at about 1,000 women. And the mean time to treatment was over 3.5 years. A quarter of them waited over 5 years. And when they drilled down and asked, well, why did you wait so long? Why were you suffering? The answer was they didn't want surgery and they didn't know about UFE. They weren't given these less invasive options. And unfortunately, we don't spend enough time either in training or in practice on the preventative side. You know, you kind of wait till the car's broke and we come along and fix it. But we need more emphasis on preventive stuff. And we do talk to patients about, because we'll see patients, let's say, that they want to know, what can I do? Because there are genetic things you can't pick your parents, at least not currently. But there are some things you can do, like well, we don't know where fibroids come from, and that's a problem. We can talk about the lack of research, but once they arrive, they grow with estrogen. And estrogen is in the water, it's in the food, but there are certain hormone-rich foods, red meat, non-organic chicken, dairy. And then there are some things like vitamin D that is a very powerful, it's really a hormone, blocker of fibroid growth. And only 10% of African-American men or women have adequate vitamin D. So that can be a risk factor. It's one of the reasons why they disproportionately suffer with fibroids. Body fat. Estrogen is stored and produced in body fat, and in general, African-American women have more body fat than other racial groups. That's a risk factor. So there are certain things you can do by trying to get healthier eating, lose excess body fat, check your vitamin D, because if you have a normal vitamin D, your risk factor for suffering with fibroids is much lower. So certain things you can control, and there are certain things you can't control.
Well, I'm glad that you mentioned that, because I was going to ask for just a list of things, and I want to we have just a couple more minutes. Anything that people watching at home can do? Dr. Lipman obviously mentioned a lot of good things, but any other things that come to the top of mind to help, I don't want to say prevent fibroids, because we know most of the time it's not preventable, but potentially maybe even help with some of those symptoms?
I think, yes, Dr. Lipman mentioned a lot of things that you can do to help to decrease the symptoms. I think one of the other important things to do, you had asked about how do you find providers. I think it's really important for people who have a uterus to talk to other people who have identified someone that they trust, someone who they feel really helped to give them information. I know that organizations like yours, for example, has resources online, and there are different entities. I know Morehouse School of Medicine has an online resource as well. It really is important for people who have had good experiences to share the good experiences with others so that more and more people can get the information. And I also agree with you, Dr. Lipman, we have to do more education. There's not enough education going on at all of the levels of training, whether it's med school, nursing school, PA school, to really make sure people know the information and then feel comfortable discussing it. Maybe it's about going and shadowing a radiologist and seeing what the procedure involves so that you can more confidently discuss it with your patients. And that's something I know I've done, when I was at Grady Hospital, spending some time and going to the radiology suite and saying, hey, what happens during this procedure? I really want to be able to answer my patients' questions before I send them for that consult with the radiologist, because there are always some baseline questions that they have before they go to the next person. So that's what I would say. I would say really spend some time and talk to trusted loved ones, other people with uteri who have had similar experiences, and get an understanding of what worked for them and if they would recommend the person that they saw if they felt that they got the help that they needed.
I agree 100%. And it's important that people understand that fibroid treatment is not a one-size-fits-all. It's just not, right? And it's very, very critical that you understand that. And as you're going through your fibroid healing journey, there's so many other things that you can do to try to help mitigate a lot of the symptoms. But it's also been a proven fact that you can shrink them naturally by way of removing certain things from your diet and adding other things into your diet. So for example, fried foods, foods that have highly processed, a lot of ingredients. If you're unable to pronounce the majority of the ingredients is probably not healthy for you, which is probably conducive to any type of medical condition, right? But also doing other things like taking natural vitamins and herbs that are clean and toxic free. That's very, very critical. Really also helping to eliminate different types of toxins from your body, such as the sanitary products that we use. Making sure that those products don't have things like dioxin in it. You want to get clean sanitary products. You want to be able to have access to them easily. But the other things is just doing things that can help lower your stress level, because stress has been proven to help to actually mitigate and the growth of to grow uterine fibroids. So doing things like qigong and yoga and meditation has helped me tremendously. But the last thing is that it's very important that people understand that it's just not a one-time situation. It is very important that this becomes a lifetime change from here on out. It's not let me try to reduce these fibroids so I can go on my girls' trip in August. It's not let me try to reduce my fibroids because I'm about to get married in 2 years. No, this literally has to be a complete life change.
Yeah, absolutely.
And I'd mentioned we need more research. I talked about, just alluded to it earlier, but it's a huge disparity. If you look at fibroid research, roughly $18 million is spent a year on fibroid research, which may sound like a lot, but it's really not. For a condition that affects probably 30 million women, the amount of money per person affected is about 62 cents if you look at it. If you take a condition like cystic fibrosis, which affects primarily Caucasians, instead of 30 million people, it affects about 30,000, say most of whom are Caucasian. They get 90 million a year. So it's over $3,000 per person affected versus 69 cents. I mean, that's just unacceptable. And there is legislation. In fact, you alluded to Kamala Harris. Well, the original legislation is the Stephanie Tubbs Jones Fibroid Research and Education Act. She was in the U.S. House of Representatives and unfortunately passed away. She suffered with fibroids. And so Vice President Harris, Cory Booker in the Senate has got the Senate side, Yvette Clarke from New York in the House of Representatives has the House side, and it's been sitting there for years, and it directs the CDC to put the money towards, adding money. I think it's, I want to say 30 million a year for 5 years, plus the CDC to put out educational materials about fibroids and symptoms and educating physicians as well as the lay community. But that legislation just sits there. And it's really a shame because that really could help be a good first step in trying to, because we don't know where fibroids come from. And that's, a condition that affects so many women and we don't know where it comes from. It's unacceptable. And the disparity in research is really just one of many. And it's unfortunate. We need to change that.
I cannot agree more.
Well, I want to thank you all so much. There's still so much to talk about. I have just so many questions coming in. I'm sure a lot of people at home have more questions. So if it's okay with you all, I'm going to leave ways to get in contact with the three of you if people watch this and they have questions. We'll make sure to put that on 11alive.com. But once again, thank you all so much for coming in, sharing your expertise, and I hope that people were able to take something away from it. Again, we have Dr. Lippman here, Mr. White, and Dr. Madeline Sutton. We will put all of their information and ways to reach them on our website, 11alive.com, along with more information about fibroids, people's journey through fibroids, the different options that we talked about here, just so that you at home can learn about it. So once again, thank you all so much for joining us in this conversation. Let's talk about fibroids. We'll see you later.